I'm Sanda Carniciu. I'm a private neurologist in Sleepy Hollow and the director of the Stroke Center at Phelps Memorial Hospital. I would like to talk with you today about few facts about strokes and transient ischemic attacks. First of all, I would like to let everybody know that our Stroke Center at Phelps Memorial Hospital got again recognized with a Gold Plus Award for our outstanding performances in taking care of patients with strokes. If you didn't know, a stroke is actually a brain attack. Every minute is important. Early recognition and treatment of the stroke are also important for the patients. Strokes remains one of the most disabling medical conditions, leaving all the patients with major disability. Both strokes and transient ischemic attacks can present similar. A sudden onset of a severe headache with no cause, or of a sudden onset of mental status changes, again without a cause. A stroke is produced by a clotting of an artery, which blocks the blood supply to the brain. A transient ischemic attack represents a completely reversible neurological situation in which stroke-like symptoms developed, however, they completely resolve and leave the patients without any deficit. However, it might represent a strong indicator for a full-blown stroke in the future. Risk factors for strokes are the same as the risk factor for transient ischemic attack. Family history of a vascular neurological event, physical inactivity, atrial fibrillation, drinking and smoking are also very important. I would like to emphasize that strokes have an enormous impact on almost everybody's life. I don't know if you knew that 4 out of 5 families in the United States are affected by somebody close with a stroke. I don't know if you knew that every 45 seconds somebody will have a stroke in this country, and it may kill 1 American every 3 minutes. And definitely strokes kills twice as many women compared with the breast cancer. So the enormous impact have to be recognized. Stroke is a disease of an elderly, and the older we get, especially due to the aging process in the United States, the higher chance of getting a stroke. Sudden onset of any neurological dysfunction, headache, visual problem, speaking problem, thinking and communication problem, walking problem, weakness and numbness on one part of the body, should call immediately 911 and ask them to be transported to Phelps emergency room, a state-of-the-art facility ready to embrace everybody and to offer the appropriate treatment.